as we are out of time, so we can't take many questions, but we can take a few. So there is a question from a student. How is COVID affecting the mental health and studies of the students studying in higher classes in a positive way? If any of the panelists want to answer it.
Okay, just let me, with the looking at the time constant, let me just quickly give an outcome that yes, the students have a lot of positive outcome. Like, what is first positive outcome is that students become very responsible. What Dr. Ilora has already said, that they become responsible because it is not driven by the teacher. They have to be proactive to learn. So what we have seen, that the good student become good. But the challenge is that the student who are not so good, who are below average, is facing real difficulties. They are not able to come up. So the good students are doing much better, but the below average, who needs teachers push little more, who are not able to take up, is having problem. Another, they are at home, comfortable situations. So the people who have the comfort at home, have a separate room, they are doing good. But on the other hand, the students for the first time got a separate bed in a hostel, doesn't have that. So those kinds of students who have those problems are really facing very difficult, because there is a joint family, cannot get a real space to study like in higher education, so getting problem. Third aspect, I would say, there are a lot of lab-based course. A student has to do it, a lot of looking into it and then trying out. So the student who is able to afford, who is able to do it with some other connection, is able to do it. But there are many students who are unable to afford. So I see that digital divide has come up. The digital divide is making the people who are able to get it doing better. So you need to rethink that the people, the students who are unable to get the services, how to reach out to them. But as a whole, positive, I said these three aspects, we see that proactiveness, doing it, everything is increasing. One danger, I would say, is the digital dependency, which is also coming in different research. The student surfing the restricted site because they have got for the first time, particularly the adolescent student of 9th and 10th children, when parents are uneducated, unable to monitor what the child is doing, are getting into those kind of digital addictive risks. So we have risk, but still these positivities which are coming up are definitely need to be nurtured and sustained for future. They become much more digitally advanced. Any other panelist can respond. Thank you.
If anyone wants to add something in this, any other?
Yeah, I just want to say that
Nothing much to add
a
to
lot of
that.
self-learning is happening with the students, and though we used to see that peer learning, like weaker student being getting information from a better student, has but then self-learning, they have to find out their own resources and learn. That is happening quite a lot. Yes, sir. Thank you.
Thank you, sir. So we are moving to the concluding session. So I would like to invite again Professor Santosh Kumar for his short concluding remarks, sir. Over to you, sir.
Thank you. It was a wonderful session, listening to everyone. And a lot of solutions have been suggested, what have been practiced out before the COVID and after the COVID, which is when there was a slash and then the second wave came, and the concern for the third wave as well. NIDM is also having a working group, and where you can contribute on this, how to prepare for the third wave, and especially in relation to the children's care. And in the third wave, what is the possibilities of kind of likely to affected children, and how these could be, what kind of a strategy which we can suggest that each of the state government and the community can take. One is the suggestion for the government, another could be for the community, and those community institutions can come into a kind of a forefront and take care of that, as all of you have spoken about that, and the various initiatives which have been very successful during that time. And some tools which I flagged in the beginning, that what are the essential tools which you think is important to understand the trauma care, and how the habit and behavior could be a kind of a positive story was shared, that how children they are looking at as a kind of a, when they are writing essays in their school. And many of times we are thinking pandemic, but many a times it is also thought as a kind of a festival. So understanding the minds, young minds, is much more important. Their engagement of COVID-19. In our neighborhood also, we find that children are, the moment they get, even if the smallest of the kind of opportunity to come out and interact, their peer group, and they are playing and everything. So one that probably we need to understand in this kind of trauma care, that what is the likelihood of infection rate amongst the children in the third wave. And during the first wave and the second wave, we were of the view that children will not be much of a career kind of a thing, but some studies said that they are potential career. But disease will not be a kind of a very serious. And two of the cases which were brought from Maharashtra, large number of children got affected, and also other states also. There, the doctors are saying that although large number, 10% of the children got affected in COVID-19, but the severity index was much less, and so hospital care was not there. So that also protects parents also going into trauma, and also the children going into the trauma. So how we can draw these positive stories for building our own capacity mentally, that how mentally we can get alert, which you people have beautifully narrated through case studies, and that was brought in. Nobody went out and they don't have opportunities, and many a times they become orphans. Children are also becoming orphans. This particular COVID wave 2 has been the example of kind of children getting orphans. So taking these two lessons, and also the case study which was also presented by Professor Rao, and then further elaborated by Mr. Ahmed, when the first presentation was made by Mr. Subasis, Professor Subasis. So when we combine all together the learning, which we say that it has to be given top priority, the mental health care, number one. And this cannot be negated, and it should be brought in the forefront for the preparing for the third wave, and also for any other disasters which we are likely to face. One example came that from West Bengal, that during the COVID-19, there was also a kind of a disaster. So in West Bengal, in Orissa, and in Gujarat, in Mumbai. So this kind of examples are coming, which is a kind of a cascading impact of disasters. One, that communities are affected by pandemic. The other is community are also getting affected by the disaster which is occurring due to natural activities. And the third is that poverty and other challenges which are there. So what we say that it multiplies. So mental well-being depends on many factors, and in what factors the people are positioned into. So there the suggestions which have been offered by all the four distinguished panelists would be very, very useful for us in taking this input. I'm sure that you would be sharing your PowerPoint presentation. And even if you are having some problem in sharing that PowerPoint, you can share your content, which we can use in the kind of the other report. And this report, or the workshop of this report, will go to the working group report. And there we can bring in those issues what you have flagged. So, and the questions which have been asked by the participants in the beginning of this webinar, and which will be addressed by all the distinguished speakers. So I'm grateful to all of you, and the kind of presentations and the kind of good learning, and a very kind of a thinking that you have given a very positive environment, that in how in this positivity the mental state and trauma could be taken care of, whether it's a wave 1 or wave 2 or wave 3 and subsequent waves, or maybe any other disaster signal. We need to prepare, and if we are prepared, the challenges are and the impact would be reduced to minimum. So I express my gratitude to all of you and thank you very much for one that being with us, coordinating with us, and making your views, sharing your views with the larger audience. And for this, we have definitely benefited. So my team, Mr. Ali Haider, our executive director, Major General Manoj Kumar Bindal, and all the technical team who is working behind. So I extend my heartfelt thanks to them. And also, we are grateful to the participants who are there and attended this program. Without them, it would not have been a very, very successful program. So I just close here. If Ali has to say something, then he can say. But on behalf of NIDM, once again, I extend my gratitude to all of you. Thank you very much to the Central University, Rajasthan. Thank you very much. And also our resource person from Kolkata, she brought the major point from. Thank you very much to all of you.
Thank you, sir. Thank you very much for your concluding. Thank you, everyone. It has been a wonderful session. As a formal vote of thanks, I would like to extend my sincere thanks to Major General Manoj Kumar Bindal, Executive Director of National Institute of Disaster Management. I would also like to extend my sincere gratitude to Professor Santosh Kumar for his guidance for the success of this webinar. And I would also like to thank to all the guest speakers, Dr. Shubhashis Bhadra, Dr. Prashant Roy, Ms. Ilora Barikshil, and Dr. Atiq Ahmed. We are very glad that you could take out your precious time and shared with us your experience and precious knowledge you have. At the end, I would like to thank all the participants for showing interest and being with us throughout. With this, we would like to conclude the session. Stay safe, stay healthy, all of you. Thank you all.
The story of BMW. Thank you.
You are connected and maintain your safety situations. I hope to some extent it might have given some answer. Yes, Ali, you can take up the next question.
Yes, sir. So it was a nice answer, sir. Sir, this next question that how that there is a barrier because of the lockdown. How to interact with community in the times of COVID special lockdown? How can we can interact?
Yes. See, lockdown is there definitely. We need to understand, take care of the lockdown and the COVID protocol. No way we are supposed to break the lockdown. But we also understand what is possible within lockdown. In a village area, in an urban area. So now lockdown characters also have changed. So first of all, being available doesn't mean only physically present. Even giving a call and asking how are you, what is happening. So being connected digitally is the new platform which you need to use and activate. Like we have seen a lot of digital volunteership in mobilizing plasma, in mobilizing oxygen, in mobilizing ambulance support. These are happening. So be connected wherever possible. Create the group, connect them, connect through one member, talk to others. So being connected wherever possible, do visit. If there is a big field, if there is a big place in the rural area, there is no dark place usually. So if there is a common place, so bring them together, maintain physical distance, and you can talk, you can have yoga together, maintaining the distance, and being that togetherness helps a lot. Maintaining the COVID protocol. There is no question of breaking the COVID protocol wherever it is possible, because when you come to the nature, when you come to a green place, those kind of chemicals heals our body, and those natural situation called as a naturopathy, which helps us to reduce the stress. So we have to see what conditions they are, what condition we are, what is possible. Considering those limitations, the physical presence should be considered, or else digital platforms should be used. So I talked about digital volunteer. We need to create the digital volunteers more to get connected within us, and we can use the youth and others who have better digital knowledge and can work as better digital volunteers. Okay. Thank you.
Yes, sir. Thank you very much, sir.